Hello, welcome to Wellness and Wisdom with Dr. Nadu Tuakli, the podcast dedicated to empowering women over 40 to age gracefully, competently, and beautifully. I'm Dr. Nadu Tuakli, a family doctor, preventive medicine specialist, author, teacher, mother, and expert in hormone replacement, anti-aging, and longevity. Let's celebrate the aging process with vitality and purpose because your best years are still ahead. Subscribe now to add more life to your years and step into the best version of yourself. Thank you for joining us again today. Today, we're asking a question that comes up quietly in so many lives. Do I drink too much? Is that glass of wine harmless or harmful? Alcohol is deeply woven into our culture. How we unwind, how we sleep, how we cope with stress and anxiety, and socialization. And yet the line between normal and harmful is often far less clear than we think. My guest today is Dr. Kimberly Forde, a nationally recognized hepatologist and liver transplant specialist doctor. Dr. Forde is an assistant professor of medicine at the Lewis Katz School of Medicine at Temple University in Philadelphia. She trained at the University of Pennsylvania and one of my alma maters, Johns Hopkins School of Public Health. For those who don't know, a hepatologist is a doctor who specializes in liver disease. Dr. Forde's work focuses on liver disease, alcohol-related liver injury, and the long-term consequences of drinking patterns over time. She cares for patients across the entire spectrum, from early liver dysfunction to advanced disease and liver transplantation, and brings both clinical experience and research experience to this conversation. One reason I was especially eager to talk with her is that I see every day in my own practice women in perimenopause and menopause who begin drinking more, not out of excess or recklessness, but to manage very real symptoms: disrupted sleep, anxiety, mood changes, and that sense of being constantly wired but exhausted. Hormonal shifts change how alcohol is metabolized, how it affects sleep, and how it impacts the liver. Yet many women are never told this. Instead, alcohol quietly becomes a nightly coping strategy at exactly the time when their bodies are least equipped to handle it. This conversation is not about shame or labels. It's about understanding what actually happens when you drink alcohol and what it does to the liver, why women may be more vulnerable than they realize, how patterns of drinking matter as much as the quantity, and how informed choices, including better treatment of hormonal symptoms, can dramatically change long-term health. Dr. Forde, welcome. Thank you so much for joining me.
Thank you for having me.
So my first question is about you. What drew you to hepatology? Was there a particular moment or a patient that sparked your interest?
So I was a resident at Columbia, where I had engaged in medical school training. I was a physician in training at the time, and I met a young man who had acute liver failure as a result of a virus. He had come into contact with hepatitis A, which is actually a rare cause of acute liver failure. And in taking care of him, I gained a healthy respect for liver disease and what it can do to the human body. In addition, I felt helpless, and I really thought that his particular case brought to the forefront issues about access to care, opportunities for receipt of quality of care, and really the socioeconomic challenges faced by many of our patients. So really that was an aha moment for me that brought together all of, my interests and concerns for, the patients that I care for.
So what do you find most fascinating or misunderstood about the liver?
So it's fascinating because it regulates a lot of different functions within the body. It is a powerhouse. It makes proteins that are very involved in different processes within the body. It detoxifies the blood. So when you take a medication, it breaks down that medication into the active ingredient and some of the other ingredients that may or may not be harmful to you, and utilizes it in the right fashion. I think one of the misconceptions is that we can appropriately replace or take care of all of the functions that the liver executes. And really, we cannot do so. There is no form of effective liver replacement like there is for kidney disease and going on dialysis, or for the heart when there's difficulty pumping. There are balloon pumps and other devices that can be used to help patients or bridge patients to transplant. So we don't have those things in liver disease. And I think that that's one of the misconceptions, certainly, that I see.
And what surprises you most about alcohol-related liver disease when you talk to patients in terms of their understanding?
I think that there are a lot of misconceptions. One is that it may help with sleep. It actually can disrupt sleep, and specifically the restorative portion of sleep. Another misconception is that high tolerance means that there's no dependence on alcohol, and that is a false statement as well. You may certainly have physical dependence. Some of the other misconceptions that I come into contact with: I don't consume that much alcohol, or I often will consume alcohol with friends and they consume much more alcohol than I do. I think one of the other misconceptions is about the profound benefits of alcohol. And while there may be some benefits of alcohol, there's certainly risk that has to be balanced when we talk about benefits of alcohol. And really, in a very narrow sense, we'll briefly talk about maybe the benefits of wine, and red wine specifically, a little bit later on in this segment.
So that perspective gives you such a unique vantage point. Stepping back from your own journey for a moment, I'd love to zoom out and talk about what you're actually seeing now in clinical practice when it comes to liver disease and alcohol. What is currently the leading cause of liver disease in the United States?
So currently, the leading cause of liver disease in the United States is what we call MASLD, or MASH, which is metabolic dysfunction associated steatohepatitis, or steatotic liver disease. I would say that a close second is alcohol. And if we look at certain age groups and certain populations, we see that alcohol is actually number one for those groups. So young adults, 15 to 44, women, and some ethnic groups, alcohol is actually the number one cause of liver disease.
And steatorrhea comes from cholesterol, correct?
The steatohepatitis, you mean?
Yes, steatohepatitis.
So we see that in patients who have the metabolic syndrome. So overweight or obese, high cholesterol, hypertension, in addition, diabetes or pre-diabetes. So we are seeing steatotic liver disease manifest in patients with those metabolic risk factors.
But does that usually cause a need for transplantation?
It certainly can. While the number one cause of mortality in patients with metabolic dysfunction associated fatty liver disease happens to be cardiovascular disease, the number three cause of mortality is liver related mortality. And so it can certainly cause liver dysfunction and the need for liver transplantation. I will tell you, eons ago when I was in medical school, it really wasn't appreciated that the metabolic syndrome and kind of the fifth manifestation of metabolic syndrome, which is fatty liver disease, could cause cirrhosis and go on to require liver transplantation. But it is certainly a very prevalent cause of liver disease currently.
Now, are alcohol-related liver illnesses increasing or decreasing, and why?
They are increasing. We actually saw a pretty profound increase during the COVID-19 pandemic. So a lot of increase in alcohol consumption during that period of time. And you spoke about coping mechanisms. And so I certainly believe that an increase in alcohol consumption was one of the coping mechanisms that many people employed during the COVID-19 pandemic.
And now you're starting to see the consequences of it.
We are certainly starting to see the consequences of that. Whether it's alcohol use disorders or whether it's alcohol-associated liver disease, we are seeing those consequences.
Are you seeing differences by gender? Is alcohol more harmful to women's livers?
So alcohol is in fact more harmful to women, and there are certain reasons why: physiologic, metabolic. There is smaller body size usually in women, increase in fat content, decrease in water content, which actually changes the volume of distribution of alcohol. So for any given amount of consumption, if you compare that to men, women are going to have a higher alcohol level. So it really is an increased risk of harm in women when they are consuming the same amounts of alcohol that men are consuming.
Are you noticing changes by age group? Are people starting to drink earlier or developing liver disease earlier?
So we are seeing a lot more liver disease in young adults. The CDC has data that ranges from 1999 to 2022. And in that particular cohort, we're seeing an increase in severity of liver disease and mortality for those consuming alcohol who are ages 25 to 44. So really an increase in young patients.
So when people hear those trends, the very next question is almost always personal. Okay, but what does this mean for me? Let's talk about how much alcohol is actually too much. This is the question that everybody wants answered, right? Is a glass of wine worse than a can of beer? Or does it all come down to the alcohol content?
So the equivalents of alcohol are really quite important to understand. And so a 12-ounce can of beer is going to have an equivalent amount of alcohol as 5 ounces of wine. And that has the same amount of alcohol as 1.5 ounces of spirits. So the amount matters, and the volume of alcohol included in a beverage matters. But I think it's important to understand the equivalents. So again, beer, wine, and spirits, and how that really translates into an equivalence of alcohol content.
Is it more harmful to binge drink occasionally or to drink small amounts regularly?
That's a really hard question to answer. So we do know that binge drinking falls under what we call excessive drinking. And so binge drinking is defined as 5 or more drinks in men or 4 or more drinks in women in a period of 2 hours. And that actually is equivalent to what we would counsel people as being heavy drinking. And so excessive alcohol intake leads to adverse health outcomes, increases morbidity, increases mortality. You brought up binge drinking, and then I think the other thing to understand is what we consider moderate. And so a moderate amount of alcohol, this is based on information from the U.S. Department of Health and Human Services, constitutes 2 or less drinks daily in a man and 1 or fewer drinks daily in women.
And so a glass of wine every day sounds like might be a little too much. At what point does alcohol use cross into the too much category for the liver?
So that's a really complex question to answer. So certainly patients may have risk factors for the development of liver disease. One can be concomitant liver disease. So in somebody with metabolic syndrome, they may have underlying fatty liver disease, and that 1 glass of wine may be too much for them. There are also other risk factors. We talked about gender being risk factors. There are genetic risk factors as well. And so it's important, I think, to make sure that the alcohol consumed is below that moderate level. And if patients have specific concerns about their risk factors, they can certainly have an evaluation for underlying steatotic liver disease, fatty liver disease, which includes just some routine blood work and an ultrasound. Routine blood work would be able to pick up any abnormal liver tests, certainly, and other of liver dysfunction that may be able to be identified on just a routine panel, a CBC, a CMP.
So we talked about drinking modestly, and some people drink modestly and develop liver disease, and others drink more and they don't. But as you said, there may be genetic factors, they may have metabolic syndrome, they may have different risk factors So let's talk about how dose, duration, and individual biology come into play. Is liver damage more related to how much you drink or how long you have been drinking?
Dose and duration are very important. When I take a clinical history in the office, I certainly try to elicit from my patients how much they drink on a daily basis, if I cannot determine that, how much they drink on a weekly basis, as well as for how long they consumed at that particular level. And I think all of that information is really important in determining whether someone might have long-term effects of alcohol use on the liver.
But there's not an equivalent of pack years for alcohol the way there is for cigarettes.
It's not only the duration, it's how much alcohol was being consumed for that particular duration of time.
This is where I see so many midlife women, especially in perimenopause and menopause, getting caught off guard. Alcohol becomes a tool for sleep or anxiety relief, and especially at a time when hormonal changes make its effects more potent. And then there are situations where the usual rules don't seem to apply. So I'd love to touch on a few scenarios where alcohol behaves very differently in the body. Why is alcohol more dangerous after bariatric surgery?
There's research to suggest that there's actually a twofold increase in alcohol use disorders after bariatric surgery. So some patients may be consuming more alcohol. But in addition, there are changes in absorption, and those changes actually seem to accelerate liver disease. I would say the other piece of this is that many patients who are obese and require bariatric surgery may also have some underlying liver disease. They have steatotic liver disease. Mm-hmm. And so this may be a further insult to the underlying liver disease which is present.
Does bariatric surgery have other long-term effects, positive or negative, on the liver?
There are certainly positive effects of bariatric surgery. I would say specifically it leads to sustained weight loss in patients. And so in that setting, you can have a decrease in the constituents of the metabolic syndrome, including diabetes. So there's a propensity for cure of diabetes in that setting with the weight loss. Specifically for patients who have underlying MASH or metabolic dysfunction associated steatohepatitis, there's an improvement and even a resolution in the underlying liver disease, as well as an improvement in the fibrosis and improvement in the scarring that's present. So there are certainly beneficial effects of bariatric surgery. And then across the board, there's a decrease in morbidity and mortality for patients who undergo bariatric surgery.
Do the GLP-1 medications affect the liver at all?
It's wonderful that you brought that up because GLP-1s actually do improve inflammation in the setting of fatty liver disease as well as fibrosis. And the FDA just approved semaglutide, also known as Ozempic or Wegovy, for the use of or for use in patients with fatty liver disease with stage 2 or stage 3 scarring. And the improvement that patients get with GLP-1s actually surpasses the only other medication that we have that's approved for the treatment of MASH. So I'm glad you asked that question. There are many benefits to GLP-1s, but certainly there is a benefit in the setting of fatty liver disease.
Yeah, they seem to be affecting almost all the vital organs in the
systems.
body.
That is correct.
So many people have reflux. A lot of people complain about GERD, chronic reflux. Does that affect liver health at all? I know it's affected by alcohol use, but does it directly affect the liver?
I think it's controversial. So there is, again, a twofold increase in fatty liver disease in patients with GERD. The conditions often overlap. Some research suggests, though, that GERD is actually a consequence rather than a direct cause of the liver injury. And so I don't know if that's mediated through obesity, which tends to increase GERD and may increase fatty liver disease as well.
Is there a test that can definitively determine whether someone is an alcoholic, or is that the wrong question? Were these the tests that you were referring to earlier?
We have some screening tools that we can use. There is a tool called the Audit C, which is just a group of questions that's been validated to determine whether someone is engaging in harmful drinking. That particular tool is what's suggested for screening based on the U.S. Preventative Service Task Force. There are some other tests that are available, alcohol level being one, and something called a phosphatidylethanol level, which can tell us about harmful drinking over the past 4 weeks. So a level that's over 20 suggests that there is moderate to heavy drinking that the patient has engaged in. Personally, however, I use the serum tests more to tell me about whether a patient is resuming alcohol intake after a period of sobriety, or they're on therapy and we want to determine whether they're decreasing the amount of alcohol that they are consuming. So I don't use those tests to say yes or no, someone, is taking in too much alcohol per se, but how it may affect my therapy, how I may be able to help them to decrease the amount of alcohol that they're taking in. I would also say that sometimes patients are not aware that they're taking in as much alcohol as they are taking in, and a level that is over 20 can be very helpful in persuading a patient to look at their alcohol intake in a different fashion. The last thing I want to say is in the field, we've tried to move away from the terminology alcoholic. It can be very stigmatizing. And so we use alcohol use disorder, or we use alcohol associated to talk about or engage in a conversation about the type of injury that is ongoing.
For some people, despite interventions, the disease progresses. Can you walk us through what happens when liver damage reaches the point of advanced disease and transplant becomes part of the conversation? When does liver disease progress to the point of needing a transplant?
Patients will develop scarring in the liver. Advanced form of scarring is cirrhosis. It is a histologic diagnosis, but we can determine whether patients have cirrhosis by looking at other telltale signs on their imaging studies, so a nodular looking liver or other changes that we see there. There are two different stages of cirrhosis. One is compensated. The liver is still executing all of its functions without interruption, versus decompensated. And when patients are decompensated, we see the complications of liver disease. We see jaundice. We'll see accumulation of fluid in the abdomen called ascites. We can see confusion because the liver is no longer detoxifying the blood. That's hepatic encephalopathy. And we can also see variceal bleeding. So bleeding that occurs because of alternate channels that form to get blood back to the heart. When patients have a complication that is a reason to really refer for liver transplantation, the other scenario in which we will refer somebody who may not have all of those complications is when they have been diagnosed with liver cancer. So cirrhosis increases one's risk of developing liver cancer, and that risk is really cumulative over time. When someone is referred, they are evaluated by one of the medical transplant docs, such as myself, one of the surgical transplant physicians. A social work assessment is performed, and if alcohol and or mental illness is in the history, they also meet with a psychiatrist. There's diagnostic testing that also occurs, which allows us to determine whether a patient would be medically fit to undergo transplant. Once all of the testing and the consultations have been performed, as a team, we will discuss the patient's case and then determine if they are an appropriate candidate for transplant. If they are, then we'll get them listed with the United Network of Organ Sharing, UNOS. And then what happens is, based on the severity of their liver disease, we update that score. It's called the MELD score. We update that score at certain intervals, and if they rise to the top of the list and there's an appropriate order, they can get transplanted. With respect to alcohol-associated liver disease, we don't have hard and fast rules about the amount of sobriety that's required for patients. As a starting point, a 6-month sobriety period, that's not necessarily the case. There are other markers that tell us about the likelihood of recidivism post-transplant, including social support and success with engaging in rehabilitation programs previously that tell us a lot of additional information about recidivism post-transplant. But it is a very complex sort of decision making regarding the alcohol use. And so it's not, we don't follow a hard and fast rule with respect to sobriety.
So how many transplants are performed in the United States per year?
So over 7,000, we have increasing the amount of potential donors by performing live donor liver transplantation. And so that's been the primary way of expanding the donor pool. There are also what we call extended criteria donors. So donors that are a little less than perfect, but the organs are, still wonderful organs and work after implantation. But, sometimes in a year, up to 20,000 registrants are on the list awaiting organs. And so we do have an organ shortage.
We have an organ shortage, you say?
Yes, we do.
And when you do a liver transplant, do you take out the whole liver? Do you transplant partial liver? How is it actually performed?
The entire liver is removed. A living donor is identified, and then one of the lobes is removed and implanted into the recipient.
And how long does the surgery usually take?
It takes hours. So depending on the complexity, it can take 12 hours, 13 hours, etc. No liver transplant is simple, but if it's a simple procedure without difficulty, 6-7 hours.
And what are the current success rates and long-term outcomes?
Currently, 1 year survival approaches 90% for most of the programs throughout the U.S. Long-term survival, there are patients who have been surviving decades. 30 years was the longest patient that I had in my practice who had survived a liver transplant. So the outcomes are wonderful. Certainly our goal, though, is to prevent patients from having to require a liver transplantation. And I think that's why discussions such as these are so important and impactful.
So the organ shortage for liver, is that similar to the organ shortage that we have for kidneys and heart transplants, or is not quite as bad?
I certainly feel like it's very bad, maybe because I work in the field, but there are organ shortages all around. I think we have issues that are akin to heart transplant and lung transplant because there are some matching considerations when we look at liver transplantation. So for women in particular, if you're a small woman, then you may have a higher mortality because of this issue with having to find an appropriately sized donor organ for you. So I think it kind of magnifies the organ shortage that we do have.
Is there any research going on into alternatives like pig or bioengineered livers that is realistically promising?
They have done some research on some molecular absorbent circuits, kind of putting us into the mindset of dialysis or albumin dialysis. Unfortunately, because the liver's functions are so intricate, we have not been, really successful in that regard. But there is certainly research that is going on. We haven't identified a system that will really provide us with the same level of improvement in liver function as transplant.
What's striking is that by the time someone reaches that stage, alcohol has affected far more than just the liver. Can we talk a little bit about what else is happening in the body? Because what other organs are vulnerable when you have excess alcohol use?
So the pancreas, certainly we'll see patients with recurrent bouts of pancreatitis. You can have brain function that is impaired. So you can have impairment of mood, coordination, and then over the longer term, cognitive abilities. You have suppression of the bone marrow. You have effects on the nervous system. So really many organ systems are affected by intake of alcohol.
And there's emerging data linking heavy alcohol use to more severe strokes What's that connection? Is it because it increases blood pressure, lowers platelets? And how clinically significant is that?
Certainly, alcohol can act as a stimulant on the nervous system and increase blood pressure. Long term, there are thoughts that alcohol leads to chronic hypertension, increase in your risk of heart attack, increase in your risk of stroke and kidney disease as well. So certainly it leads to adverse health outcomes, and that's probably what we're seeing with more severe strokes and, manifestations of hypertension.
So are all these effects reversible if someone stops drinking?
So certainly the short-term effects, increase in blood pressure that happens in the immediate post-consumption setting can be reversible, but over the longer term, these effects are not going to be reversible.
Okay. Well, given everything we've talked about, the liver, the brain, the heart, the blood pressure, there's a lot of conflicting messages out there. And I'd love to end by clearing up a few persistent myths and leaving our listeners with something practical. So at the end of the day, is it true that a daily glass of red wine is good for you?
I would say the answer to that is maybe.
I was going to say, what do you say to your patients?
So certainly some data suggests that red wine includes antioxidants, and so this may be beneficial for heart protection. To me, I would say it's unclear what potential benefits there really are and how that balances the many, many risks that we've talked about. The practical advice that I provide for my patients is that no alcohol consumption is going to be the absolute safest. And if you're going to consume alcohol, for women, less than 1 drink daily, and for men, less than 2 drinks daily. And really, if you can stick to special occasions, I think that is a realistic goal. I would not suggest continuous or daily drinking.
So when people talk to me about antioxidants in red wine, I'm saying absolutely there are antioxidants, but there are other ways to get antioxidants without imbibing the alcohol. You know what I mean? So for the purpose of antioxidants, there are other ways to get antioxidants on board. If you could give listeners one practical takeaway about alcohol and liver health, what would it be?
I would say all things in moderation. And again, moderate drinking is 2 or less drinks in men, 1 or less drinks in women. So that would be the practical advice that I would provide them.
And what's the one question you wish patients would actually ask you but rarely do?
That is a very, very good question. I don't know that I have an answer to that. I think that I am always happy to engage my patients in a discussion about alcohol use and their patterns of alcohol use, but I do think that there is shame that comes along with discussing how much people are drinking. And if I had to tell my patients one thing about that, it would be, please have no shame with me and know that you are safe here and you can discuss how much alcohol you are drinking.
So would you suggest that people discuss their alcohol intake just in general with their primary cares when they get their annual physical?
I would. And if you have concerns, you can couch it in, I have concerns about alcohol and the potential risks to my health. Can we talk about that? Or I am consuming this amount of alcohol. Do you think that this is harmful?
That's a good one. So if there's one theme I'm taking away from this conversation, it's that the liver is remarkably resilient, but it also keeps score. Alcohol-related harm isn't always dramatic or immediate. It often happens quietly over years, shaped by biology, hormones, life stages, and habits we may not even think twice about. The goal is not fear or perfection, it's awareness. Asking better questions and understanding that small changes made earlier can have profound long-term effects. So Dr. Forde, thank you so much for helping us replace myth with medicine and for reminding us that knowledge itself is a form of prevention. Thank you so much for your time today.
Thank you.
Thank you for joining me on Wellness and Wisdom. I think the topic of do I drink too much might be very appropriate at this time of the year when people are making New Year's resolutions or enjoying their New Year's Eve celebrations a little bit too long. And today we talked with Dr. Kimberly Forde, who is a hepatologist, an expert on liver disease. And I think the most important point that she made is that alcohol is more dangerous to women than men. I hope you got that point. I just wanted to emphasize it. So I will see you on the next episode of Wellness and Wisdom. Thank you for joining me today. It's always a pleasure. Bye-bye.